Hi Bob, my name is Sarah. I'm going to be your nurse today. So as I enter the room, I'll wash my hands and provide for privacy. So today the doctor has ordered to insert an NG tube, so that'll be a tube through your nose into your stomach. He just wants to empty out some of the contents in there since you have a bowel obstruction. Do you have any questions or concerns? Do you think you'll be able to sit upright and still during this comfortably? And he says yes. So first, I'll check my order and make sure I have the right patient. So can I have you state your first and last name and date of birth? And he does, and it matches my order. So I have all my supplies here. I have a cup of water, a basin in case he may need to throw up during the procedure, and then I'll put a cloth down just to protect your gown in case we have any spills. So then I'll position the patient in high fowlers right away. I have my gloves, my NG tube, my lube. I've already made my tape to secure to the nose and to label my tubing. And then I have my suction already, my tubing is already set up, so I'll connect that once I insert the tube. So, I'm going to assess your nostrils just to make sure they're patent. And they both are. Okay, I'm going to plug one side of your nose, and then I'm going to have you breathe. And breathe the other side. Is there a side that you felt you could breathe easier through? And he says yes. He said the right, or his left side of the nose he could breathe easier through, so that's the side I will do. So I'll wash my hands again. I'll just put on a quick glove just to test his gag reflex. So I'm just gonna insert this tongue depressor into your mouth just to test your gag reflex, okay? And he gags, so everything's good there. Take off my glove, throw it away, wash my hands again. Okay. So now we're ready. So I have my lube ready. Take out the tube, and I'm going to do a measurement from the ear to the nose and then down to the xiphoid process. So without touching it to him. Okay, so I see about where my tube needs to be inserted into, so I'll put a piece of tape there to mark it. So then right away I will insert my tube into the lube so that I can advance it. So I'll make sure I'm keeping this part up, and I'll have you hyperextend your neck for me in the beginning of the process. So then I'll start to, and his neck is hyperextended, and I will insert into the nose. And then, so now that he's coughing, I'll have you bring your neck forward, and then I'm going to encourage him to swallow. He said before he didn't want to drink any water, he just wanted to swallow. So he's swallowing, and the tube is going in well. Are you having any discomfort? The tube is now in, and he says no, he's not having any discomfort. So I'm going to keep this side up so that it doesn't spill anything. And this is secure, so I'm going to just take my skin prep, and I'm going to skin prep his nose, allow that to dry, and then I'll secure the tubing to his nose. And then if I had a safety pin, after I connected this to suction, I would safety pin this to his gown upright so that it wouldn't move around and so that it would stay upright. And the suction's already turned on. Everything looks good. So I'll remove my gloves, wash my hands. Are you doing okay? Do you have any discomfort? and he says no, so then I would continue to get a chest x-ray to confirm the placement. So if I had any orders to give any medications or feedings, I would have to wait until I got results from the chest x-ray confirming it was in the correct place. I could also do a pH test of the contents to assure that it's also in the right place as a second method. So he didn't need the emesis basin, and a lifespan consideration would be just with the pediatric patients, it would be a smaller size tube and a smaller, shorter tube. So I will then document the date and time of my insertion, the tube type and length, and then I would also measure the length of the tube, and I would recheck per agency protocol. I would measure and make sure that the tube hasn't moved at all once I continue to give feedings and use it. So, are you feeling okay? Are you comfortable? So everything went well. He's not in any sort of respiratory distress, so I'd want to check for that. I'd want to check for any sorts of distress or if he didn't tolerate any of it. So I'll just clean up my materials, throw everything away, leave his room nice and neat, and that's it.